Soundbytes. Quick clips, long-term learning.
All right, next case is a young woman who came in with a positive pregnancy test and had abdominal pain. So what type of exam are they doing here?
Looks like it's a fast exam. This is a right upper quadrant view. They're using the abdominal probe. It's also called the curvilinear probe. Better depth and more useful for viewing like deeper structures like the liver and the kidney.
Great. And you can tell that based on the footprint of the probe, right? Where it has
Yes.
this curvilinear appearance versus linear probe, which is straight across, or phased ray, which sort of comes out like a triangle from one origin. So as we're scanning through the right upper quadrant, we have the probe marker oriented towards the patient's head in this case, and we're seeing the liver here in the left side of the screen. We see a little bit of the diaphragm as well, curving around this hyperechoic linear structure that's curving around the liver here. And then we have the right kidney as well. So what's the space between the liver and the kidney on the right side?
Yeah, so that's called Morrison's pouch.
Yep. So that's just a kind of like a potential space where fluid can accumulate. Do you see any fluid there?
I don't.
Yeah, no, me either. What are some other areas that we would look for in the right upper quadrant besides Morrison's pouch?
Sure. So you can look actually right under the liver, subhepatic, I guess, and it actually looks like there's a tiny bit of free fluid underneath the liver tip.
Right. Yeah. So sometimes the more sensitive area to look for early fluid is at the liver tip here, and you can see a little bit accumulating in this area here, and a little bit right here as it advances through.
Yep, I see it.
Yeah, right here. So this is subtle, but is a positive fast. So let's go through the rest of the fast. What's this view here?
Yeah, so this is your left upper quadrant. I can see the spleen towards the left side of the screen, and then the left kidney.
Good. You see any fluid accumulating there?
I don't think I see any fluid.
Yeah, no, me neither. So it looks like a pretty normal left upper quadrant. The sonographer is, of course, dealing with issues with rib shadowing through some of the views, which is kind of inevitable as you're scanning through the left upper quadrant, since the left upper quadrant view is a little bit more superior than the right upper quadrant, so you're sort of like in the lower ribs. But overall, it's a diagnostic image, but it's negative. Now we have suprapubic, and we're looking for any free fluid kind of outside of the bladder. So the bladder's here, looks pretty well circumscribed. I don't see anything obvious posterior to that. And then we have the uterus here. So what are you thinking, though, in this case? You have a positive fast, positive pregnancy test. So you look at the uterus here, and with that appearance, does that look like a pregnancy?
I don't definitively see a pregnancy in that uterus.
Yeah, me either. So you'd be concerned for what?
Potential
Diagnosis?
ectopic or pregnancy of undetermined location.
Yeah, right. So Riley, of course, went to the pregnancy scan as well. So this is transabdominal pregnancy scan, looking through the bladder here. Bladder's not incredibly full, so sometimes it's hard to get really good images. One of the tips to get good transabdominal pregnancy ultrasound images is to make sure that the patient doesn't void beforehand, so you have a nice full bladder that you can scan through. But you can see the uterus here posteriorly, and you definitely don't see a yolk sac that would be consistent with an early IUP. And then going through long view as well, don't really see anything within this uterus. So I'm even more concerned for ectopic pregnancy now. So the question is, where is that ectopic? We haven't found it yet. It's definitely not intrauterine. So we'd then be looking for the adnexa. So now we're just shifted over towards the patient's right side. We're in a transverse view right now. You can see right here is the pelvis bone with shadowing behind it. So all this between here is sort of like the adnexal structures. It's not super well seen on transabdominal imaging, the specific ovaries and things like that, but I don't see any obvious free fluid or any adnexal mass there. We'll do the same thing with the left side. And nothing really jumping out as obvious. But I will say this patient did go down, then had a transvaginal ultrasound performed in our radiology department, and which confirmed an ectopic pregnancy. So they ended up going to the OR for ruptured ectopic. So I think good teaching points for this case would be that if you have an ectopic pregnancy, but you have a positive FAST, that's surgical and needs to go to the OR versus medical management with methotrexate if it's a ruptured ectopic.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.